All right, so I guess we'll get started now. So I want to just thank everyone for joining us tonight for, of course, our town hall for the 61st district. I hope you all are well and safe and in good spirits following, of course, that crazy snowstorm we saw a few days ago, and throughout this nearly long year pandemic. I know my last town hall was like about 6 months ago. With my state colleagues, Senator Savino and Assemblyman Mike Cusick. But much has changed in such a short time, and I'm looking forward to engaging all of you in the conversation. I know many of you have already provided questions in advance. We're gonna kind of go over some of those questions. But there will be an opportunity, of course, for you guys to ask questions, because the whole purpose of a town hall is really to hear from you. And how you feel about certain things that's going on in the district, or whatever you feel in the district, right? There's no limits really here. So we're gonna start out this town hall just with a slideshow of just some things I just want to update you folks on, right? And then we'll hear from one of our deputy commissioners from the city health department on some updates from the city and their response to the COVID pandemic. So with that being said, I do want to, we'll get the slideshow started. So my chief of staff, Satanj, is gonna get that started. All right, so like I mentioned, we're going to do just a quick presentation of the district, and then we're going to go into a Q&A. I don't think anybody can unmute themselves, but we will definitely, unmute you if you do have a question. All we ask is that you use the raise hand function or the chat box function to share or ask questions. And so yeah, next slide. All right, so many of you know my chief of staff. I just want to update folks on my team for this term. My chief of staff is Satanji Agosa. Her email is over there. Brian Early is our legislative director. Javon Parnell, he's our director of community affairs. Our deputy chief of staff is Ruben Seabury, and our counsel is Lucas Guerrero. And also we have a couple interns, Alana and Viomo. The reason why it's very important to have these folks up here, listed here, is because, obviously during the first 6 months I am in Albany, and the district team is really running the show here. Not to say that I'm not in a district, obviously I am in a district, but I just want to make sure that you folks are aware of the team. You have their info, and they are very accessible. And for those of you that know them, you're already aware of that, but this is just their information. My district office, actually, we're going to open up because right now folks have been working remotely. Starting the week of February 22nd, and we're just asking folks, if you want to meet in person, please, of course, call us in advance, because we still want to be mindful that we are in a pandemic and we want folks to be safe. If you don't feel comfortable with meeting in person, we can still do that on Zoom. And of course, the office hours have changed slightly: Monday, Tuesday, Wednesday, Friday, 9 to 5, Thursday, 10 to 6. In case you are one of those folks that have a job that works a little later, we will make arrangements to meet with you on the weekend. But that's obviously, you got to call us in advance so we could schedule that in advance. And I do want to give everybody an update for those that can't stay long on this town hall. We will have a ranked choice voting event on Wednesday, February 24th at 6 p.m. So folks have an idea of what ranked choice voting is and how that will change from, how the ballot will look different from previous elections, basically. So we just want to make sure people are aware of that, and you know what you're doing when you go into the ballot box. We're not telling you who to vote for. We're just telling you kind of what that looks like now. All right, so see, these are some of our community partners that helped us get the event out. Staten Island Partnership for Community Wellness, Lower East Side People's Federal Credit Union, Literacy Inc., Staten Island Chamber of Commerce, and New York City Department of Health. And of course, we'll hear from the health department later, and then we'll talk about some of the resources that some of these folks have to offer. Right now, I'm currently chairing the subcommittee on consumer fraud protection. I'm still on Agent Cities, Consumer Affairs Protection Corporation, Authorities and Commissions, Tourism, Parks, Arts, and Sports Development, and I'm also part of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus. The only reason why we underline governmental employees because that's a new committee that I am on. And actually I debated my bill yesterday that grants paid leave for public and private employees. Yesterday, and it passed the assembly, I believe 135 votes to 13 votes. So basically what that means is if you want to get a COVID vaccination under this law, you would be granted 4 hours of paid leave to get vaccinated per injection. And this is just to make sure that employers employees do not have to choose between going to work and getting vaccinated. And, we just want to remove any barriers that are there. So that's why, we highlighted government employees and how important that committee is. So many of you know, during my first term, these are some of the bills that we passed, that I authored. I know in the picture, you only see 4 bills there, but that wall has extended, although, there's more bills on there now as a result of this. But, a lot of these bills came to me as a result of many of you folks that raised concerns with some of the things that are going on in the district. Marie's law basically make sure that, we strengthen our sex offender laws, make sure they stay away from kids. Homeless shelter bill related to 44 Victory Boulevard. Don't want to go into every single one of them, but the reason for these forums, again, is to really hear from you to see what can come out of it, where we may have to propose legislation, or we can do something where we work with the city or the state or an agency to kind of see how we could be helpful. So I just kind of want to highlight some of those bills that we were successful with. Some of the resources that we were able to secure, and then we're going to have to continue to fight for again this year. In the last couple of years, we were able to preserve the horizontal toll discount. We advocated for the New York City commercial lease assistance program. So if you're a small business that's on this town hall or in this webinar, please talk to me and my staff for more information about this, because this can help you if you have any issues with your landlord. We're able to restore the ZBGA funding for some of our cultural institutions. And distributed nearly 150, actually I think it's definitely way more than that, gallons of sanitizers and over thousands of masks. I know it's 200 boxes, but usually each box probably has around 50 to 100 masks. And I really want to give a special shout out to my team and a lot of the volunteers that were able to help us out with that effort. We secured state funds for community improvement, schools, local organizations, and cultural institutions. We could keep going. These are just some photos. The photo on the left is when the vaccine site finally opened up in Stapleton. So just wanted to better understand how that process works on the ground, making sure there was no concerns. And it looks like things were pretty smooth, at least at that particular site. I know it looks like I seized a lot of hand sanitizers and mask and gloves in that other picture. I didn't seize it. It was just more of a letting folks know that we had some PPEs prior to when the pandemic hit, or it was very intense, and there were no masks or sanitizers at that moment. Yeah, just some more photos. Next. All right, so going into this term, I think it's very important to articulate what my priorities are. And I've said it a few times, but I want to share with you folks that are on here. Investing in small business, very, very important. I know many businesses have been hurt as a result of the pandemic. We continue. I personally continue to advocate for more federal aid at this federal level to help out our small businesses, and at the state level, there are different ways in the event that the feds do not come through where we could raise revenue to help out our small businesses, and I'll get into that shortly. Definitely rebuilding our workforce is critical and important. We have to support our students' learning. I understand during this time, many Students have been working remote. I know personally, with my daughter's working remote, my daughter Maimuna particularly, I have to spend a good amount of time focused on her. And you got to think about, those households that, may have both parents working intensely, and they may not have the opportunity to, help their kids during that period. So we want to be mindful of those households and how we help those students out so they're not so far behind. So definitely that's going to be a big thing, not only this year, but in the next few years. We want to make sure that our homeowners, renters, and landlords are helped. Continue advocating for transportation infrastructure and addressing public housing improvements. A couple of weeks ago, I had a meeting with the NYPD chair about public housing and how we can get more creative about securing more funding for our public housing. There's a bill that I'm actually going to be co-sponsoring in the Assembly that would be very helpful. And I know my legislative director, Brian Early, could probably talk more about that a little later, but this is just some priorities that's on here for 2021. I know we're in the middle of a pandemic, but part of my job as a legislature is to make sure, we're obviously focused on improving the state of affairs right now, but to also make sure that the projects that the city and state promised us, don't fall through the cracks, right? So a couple of weeks ago, we had an MTA public hearing or transportation public hearing where, I asked the chairman for some updates on the BRT to make sure that does not fall through the cracks. They still got to get back to us on the timeline. I'm not happy that they did not give us a timeline on that, because this is, in my opinion, an opportunity sometimes for these agencies to kind of think that, hey, we're in a pandemic, they may forget about this. I'm not forgetting about this because this is very important to the district. The NYC St. George Fast Ferry, I'm thankful that the city gave us an updated timeline on that. So that's been pushed back to summer 2021. And we actually did get a good update from the hearing from the MTA chairman, CEO, Pat Foy, that deliveries of the new SIR train cars will be, delivered August 2022. There's an 8-month delay. At least we got a timeline there. So I apologize for these delays, but we're trying our best to make sure that we deliver, some good news at least here. I do understand that some community concerns that we did receive proposed cuts to New York State Office of People with Disabilities. And I just signed on to a letter that would help address some of these issues. This is a constant fact. For those of you that don't know, the disabled community is constantly fighting, and me as well, to make sure that the state does not keep cut because it only hurts these folks, and we want to make sure that that does not happen, especially during these times. There's been an increase in gun violence in this district and throughout the city. One of the things that I've been really focused on is trying to do more gun buyback programs in the district. We also understand that the gun violence issue is an issue that really also has to be addressed at the federal level, right? New York State has the strictest gun laws in the country and probably in the nation, but with other states having kind of loopholes, right? Many of the guns that the NYPD seizes here in New York City are mostly from out of state, and so we want to do our best to kind of, encourage people, if they see something, to say something. The community could always do its part. We're going to continue to advocate for more funding for more gun buyback programs, and working with our law enforcement to address some concerns that we can be helpful with. And in addition to that, we just want, again, I think the biggest thing is, if the community sees something, they say something. And then expanding transportation infrastructure is also very important, and the BRT, as we mentioned earlier. Next slide, please. So again, folks have questions and answers. You can use the raise hand function to be unmuted and ask a question. If you're on your tablet, this is just an example of what it looks like. You go to the raise hand, you can do that. If you're on a computer, you click on the reaction section and you can raise your hand. Um,
I'm going to introduce the chairman next.
so now we're going to introduce Dr. Stevens from the Department of Health to just give us a quick update on some COVID related matters. So Dr. Stevens, are you here? Can you hear me?
Yes, I can. Can you hear me?
Yes, I hear you loud and clear.
Great, thank you. I very much appreciate the opportunity to join you, Assemblyman. Apologies for my limitations. I just want to put up front, my technology skills are not the best, but I'm glad you can hear me. I'm glad to join you and get a chance to just talk to you.
Don't worry. We couldn't get Facebook figured out. It's all good.
I respect the effort. First and foremost, thank you, everyone. I want to just give a brief update on the city's efforts to try to contain the pandemic as we move from response into recovery. The first thing I have to share, though, is quite sobering. It's that COVID is still very much a serious concern, and we need to remain vigilant. If nothing else, I want to make sure that I am impress that upon various communities and stakeholders that I'm speaking with. Citywide, our positivity is still over 8%, and there are some neighborhoods where we're over 16%. Our hospitalizations and our deaths are still alarming, and so we still need to practice our core four: our social distancing, our washing our hands, our wearing masks, and staying home if you're sick. By way of introduction, I forgot to do this. So my name is Dr. Danny Stevens. I am a pediatrician by background, and I am the Family and Child Health Deputy Commissioner for the New York City Department of Health. Because I'm Family Child Health and I work with schools and I'm a pediatrician, I like metaphors. So when I talk about doing our core four, I say to folks, if you're in a boat with oars or paddles and you're paddling your way towards the shore, you don't want to drop the paddles when you see the shore. You want to kind of keep going. So that's the way that I've been kind of communicating and advocating for folks to continue to stay vigilant with our core four. The good news is we do have a vaccine, as you've heard. As of right now, the FDA has approved 2 mRNA or messenger RNA vaccines. They're both available and they both have been shown to be safe, but they both require 2 shots, either 21 to 28 days to 42 days apart. They do not affect a person's DNA. They do not contain the virus itself, and we should get it. Everyone should get it, even if they have already had COVID. Distribution and eligibility is determined by the federal government in close coordination with the state. The state has been working hard to kind of move those eligibility criteria on, and so we must check very frequently to see who is included. Who's eligible now? So healthcare and other patient-facing providers, people over the age of 65, police and fire, people living in homeless shelters, teachers, restaurant workers, limousine commission licensees, grocery workers, and others. You can check the DOH and the state websites for the most recent eligibility criteria. We have heard a lot of feedback on vaccine appointment and availability. And so vaccinefinder.nyc.gov is where you can go to make appointments. There's also a phone number because not everyone has equitable internet access. So 877-VAX4-NYC, and we're happy to distribute that. Our city approach has been driven by equity, and we need to start by acknowledging that there has been racism in the history of healthcare delivery, experimentation, and there are present-day biases and lived experiences that have led to not just discrimination and biases, but real gaps in outcomes that have led to mistrust and understandable mistrust. We're here to acknowledge, and we are hyper-focused on the 33 priority neighborhoods announced by the mayor on Sunday. Some of those are in the district. And we want to ensure both access and confidence in the vaccine, right? Our whole plan is to turn vaccines into actual vaccinations. Vaccines are sitting in a box. right? And Assemblyman, you mentioned before, you have masks in a box, but you want to make sure those get into the hands of folks who need them. And so vaccinations are actually people who are protected somewhat reasonably against this virus. For access, we're continuing to build the infrastructure, but we need more supply from the federal government to be able to do so. We're standing up sites to be able to distribute that vaccine. We're focusing on our neighborhoods and partnering with community-based organizations, faith-based organizations to set aside appointments. We are ensuring phone and website access, transportation access, and options for seniors if they need it, and providing information and resources in multiple languages. Now, confidence, as the other, we want to build access, but we also want to build confidence. And that's getting trusted information out through trusted messengers. That's working with partners in the community-based organizations, faith-based organizations, elected officials like yourselves. Thank you so much for the opportunity to be here, to spread accurate information and to take apart myths and myth bust. Town halls like this, smaller group sessions called community conversations, chats, are really helpful in us trying to get the message and word out. Flyers, palm cards, videos, and more. They're all available in 13 languages, so people have the info they need and feel confident in the vaccine. So I really want to say that there is some light for me. I myself have gotten the vaccine, and I actually had COVID back in March, and so I'm here to testify. I don't want it a second time, and I want to protect those members of my family and my community. So if I can stop there and see if anyone has any questions.
So Doc, we're just gonna actually, I think there's like a couple more.
Oh, sure, I'll stop there.
Yeah. So I think we'll go into the Q&A in just a second, because I wanted to just quickly address some, as a matter of fact, before we go into, we're going to Q&A in just a couple minutes. I just want to make sure that we address a couple of these things before we go in there. If that's all right with you, Doc. Are you okay with that?
That's wonderful. That's perfect. Thank you.
Thank you, Dr. Stevens. So I did want to just, go over, we received about a couple dozen questions from folks. Just wanted to read a couple of them. And if you want to just, obviously ask a question, you can raise your hand. If you're having a hard time, and the way you raise your hand is you got to kind of put your mouse on the lower part of your screen, click the reaction where the smiley face thing is at. You click that, and then it says you can raise your hand right there. For those that are not familiar with it, for those that are familiar with it, you're an expert. Thank you for understanding. But one of the questions that we received is, what is being done to combat the gun violence on the North Shore? I know according to recently reported data, 44 people were shot on Staten Island in 2020. And the North Shore has been impacted significantly by gun violence, as I mentioned earlier. I wrote the mayor and the police commissioner seeking additional funding for more gun buyback programs. And like I said earlier, the more guns we get off the streets, the safer our streets become. And I think it's, again, crucial when our communities see something, they say something. And the one thing I do want to emphasize here is that, I know sometimes folks, don't want to say something because they are concerned with some sort of retaliation or retribution. There are ways to do things anonymous, or, your identity won't be compromised as a result of that. So just want to make that very clear that, we just want to encourage that, but we also understand that folks are concerned. And if you are concerned, these are some of the things that are in place to kind of, keep you at ease. All right, then another question, and I'll do just 3 more and then we'll open up the floor. We would like to know exactly what is happening at 44 Victory Boulevard, as there seems to be a great deal of noise coming from that site. So our understanding, we've been in contact with the city on this. Excavation and the foundation construction has begun at the site of Staten Island's new homeless shelter, which is located at 44 Victory Boulevard. However, the site has yet to receive approval for full construction of the building. It's not uncommon for developers to begin work on foundation before there is a full approval. The site is still planned to be a 200 family homeless shelter, primarily for women and children. Because of the law that Senator Savino and I introduced, that is now obviously law, Department of Homeless Service must now hold community information sessions when a shelter is proposed for a community now that the legislation is signed into law. The one exception for not having these hearings is, or not having a community information session is when there is need for a short-term emergency shelter. I know just 2 more questions I'll go and then we'll open it up. Do you have any updates on PPP loan for small businesses? The PPP loan has reopened for second round applicants, with priority being given to businesses that were previously shut down or unable to apply. I know the Chamber of Commerce has a wealth of information related to this matter, and the Lower East Side People's Federal Credit Union has the wealth of information here, and I think they actually do provide those loans. So if you need more information on how to contact either of the 2 entities that I mentioned, do reach out to my staff or myself, and we'll definitely be glad to connect you with them. The last question I'll read, and then we'll open it up. How do you think we can build? So I want to just say something. I didn't name the folks that asked these questions because I didn't know if you wanted your identity out there, or if you didn't want it out there. So I kind of just played it safe. If you wanted to say, hey, this was my question, then I'm happy to say I'll give you credit for your question. But I didn't want to kind of put somebody on the spot that didn't want to be on the spot. So I was being sensitive to that. So last question, how do you think we can build better relationships between NYPD and the community? I always think that transparency and accountability are values that all government agencies should seek to uphold. When those values are displayed, I think our community have more faith and trust in our system. I think when folks see things on the camera, and then the system doesn't doesn't really address what was seen in the camera, it makes complete sense why there would be public uprising or folks being upset about it. And it just really shows the importance of why we do need continuous change within our system. But definitely, I think transparency and accountability is very important. And we also want to remember, right, there are a handful of folks that are on the job that do give a lot of officers a bad rap, but for the most part, there's many officers that I know, and I see some of them that are on this line that that have done a good job in working with the community, and I thank them for their service because they do put their lives on the line to make sure our community is safe. So thank you guys all for your service and for being on. And with that being said, Doc, I hope you're still on. Yes, he is still on. I guess we're gonna take questions now. So Satanji, if you want to kind of, I know you've been keeping track of the list. Please, yeah, let's get started with the Q&A.
Okay, I will unmute Mr. Scalisi.
Yes, Charles, thank you for hosting this tonight, and all the other folks who got you all set up with this. I do have one question on a transportation matter. I happen to be a professional transportation engineer. There's a Manhattan-based consulting firm, V as in Victor, H as in Ham, VHB as in Breslin, that's working on the North Shore busway study. And they started that work approximately 2 years ago. I haven't seen it in the advance recently, or I haven't heard any news of it recently. I know last year other things have come up, but for North Shore residents, which I am not, but for North Shore residents, I would think this is an important matter. Have you heard anything, Charles?
Yeah, so thank you, Stephen, for joining us. Yes, I actually did talk to the MTA chairman, and I raised this in a public hearing a few weeks ago. And if you guys go to my Assembly website, nyassembly.gov, and then you go under my name, you can see kind of all of the hearings that I've participated in. So I did press him on this matter of the BRT. And
Right.
he did say that, because I was concerned that they did not provide a timeline on how long the project would be delayed. He did say that it will continue to move forward, but he did not provide specifics. So we're going to continue to look for an update on that, because, since prior to me being in office, as someone that has lived on Staten Island my whole life, this, and I live right up the block from, where the BRT would pass by. And it's been so frustrating for me to see that vacant and empty and seeing a lot of illegal dumping there, So, look, as someone that's grew up here, I want to see this happen. I'm going to continue to push them as long as I'm in this seat. And it's going to remain a priority. So that's kind of where we are now. And we just got to make sure, and me personally, I'm going to make sure that this doesn't fall through the cracks where MTA would think that, because we're in a pandemic, folks may have forgotten about this important project.
Thank you very much, Charles.
Thank you, Stephen.
Okay, Mrs. Rena.
Hello. I just wanted to a sense of a return to sports. I know the governor has okayed high-risk sports for the kids to go back, and we've seen like a lot of kids that live in different neighborhoods leave like the cheaper options. We have CYO and it's affordable for us. We're able to participate. Kids that kind of got sick of waiting went to $1,000 plus gyms, and nobody seems to have any guidance for the kids that don't have that option. And I'm wondering if you have heard anything, or you're working on it, or somebody's working on it, because they're pretty bored. Those kids are also going to private schools and see their friends every day. Ours kind of don't. And I'm just curious if there's any direction as to what's happening with the middle school and high school kids.
Jennifer, thank you for that very important question. As somebody that played basketball, high school basketball, college basketball, I can't think for a second my senior year not being played and how frustrating that would be. So myself and the rest of the Staten Island delegation, we did pen a letter to the governor telling him that he should let municipalities make their own decisions when it comes to this matter. The governor did finally agree and say he'll let that happen. And so now we're working with the mayor's office on this matter. I actually personally spoke to the mayor about this a week ago, and I did get a message from his team that they're working on trying to figure out how to do this safely and equitably. So I'm on it. This is very important. We want to keep our kids active. I know they've been in front of a screen for far too long, but we want to get them out safely, but also active. And again, as someone that used to play high school ball, and I do want to kind of get our kids back out there up and going, because this is very important for not only their physical health, but their mental health,
Right.
So
I know there's a bunch of us with girls, senior girls that are on this call, and we're just kind of like waiting. And so it's resting with the mayor. We received a letter he was supposed to answer on Monday, but he didn't. I guess we're just going to have to play a waiting game.
Yes, yeah. And look, I've been talking to many of the coaches about this matter. Spoke to the, I think Kevin Pickett the other day from CHSAA, and
right, yeah.
It's well on my radar. We're on it. So feel free to keep checking in with us for updates, and I'm happy to provide an update where we are.
Perfect. Thank you so much.
I don't know if Dr. Stevens, I know you have to get off soon, so if you had any comment on this issue, or
no further comment. I do want to say that I appreciate Assembly Member highlighting the emotional well-being aspects in addition to the others. I think when I think about our youth, I'm glad folks are thinking about them through that lens as well. Because so I nothing more to add.
And I believe the Staten Island Community Wellness Initiative also does offer some free physical activity to reduce obesity rates through virtual means. So we'll definitely share that information around as well afterwards. The next question is Mr. Everett Watley.
Hi, everyone. Hello. Hello, Assemblyman. Thank you for hosting this meeting. I'm a resident. Can everyone hear me?
Yes, sir. I hear you.
Okay, I'm a resident of Tranter Place. I don't know if you're familiar with Tranter Place, but between Dixon and Forest Avenue, opposite the MLK Expressway, we have no sidewalk. There's a dirt road. So we are forced to walk in the street against oncoming traffic. That dirt road is oftentimes muddy when it rains, and the streets are flooded because the catch basins, they're clogged with debris. There's a lot of illegal dumping in that area. I've submitted countless 311 service reports to DEP, to DSNY, and to DOT, because on the other side, the embankment of that highway, it's littered with garbage. I get no response from them. What I get are closed service tickets, usually within 24 hours of submitting them. And they close them out without any reasoning. This block is a mess. I had a few conversations with Ruben from your office. That was back in July or August. As of today, nothing has changed. And now with the snow starting to melt, that street is going to be flooded because the catch basins don't lend themselves to draining. I don't know what to do. Is there somebody from your office that can work with us, that can reach out to Department of Transportation and try to get them to even look at installing a sidewalk? We shouldn't have to walk in the street against oncoming traffic. It's almost like they're waiting for a fatality to happen.
Mr. Everett, thank you so much for bringing this to our attention. Ruben, it's not here. Unmute Ruben for a second. Ruben, do you have any update on DOT's end on this matter?
Hi, hi, Mr. Watley. Yeah, so I had actually seen your emails, and I'm waiting to get an answer back from Debbie Rose's office, because last I spoke with them, I was waiting on an update to hear from them, as you said, in June or July. You know, and I didn't want to move against our office.
Ruben, DOT,
Yes.
any update from DOT?
No, there's no update from DOT.
All right, so we need to follow up with DOT tomorrow on this matter.
Right. When I contacted you, the reason I contacted you is because I'm looking for a fresh set of lenses to look at what's going on. I know what Debbie Rose's office said they did, but that was like a year ago and nothing has transpired. So that's why I contacted Assemblyman Fall's office, so we can get a fresh perspective on what's going on, and maybe you can outreach to your contacts. But it's been more than 6 months since I've spoken to you. And no contact, nothing. We're still walking in the street against oncoming traffic. And you know, the drivers don't understand why people are walking in the street and they're honking, move out the street. They don't know we don't have a sidewalk. 6 months, no response from anyone.
And that's completely unacceptable.
Yeah, no elected official, no response from anybody. Everybody's just playing the wait game. They're waiting for someone to get killed.
Yeah, and again, I apologize for that. Tomorrow morning, I'll definitely give the commissioner a call. Ruben, we have Mr. Everett's cell phone number, right? We can follow up with him tomorrow. Is Ruben unmuted? Ruben?
Yes, I do.
All right, so we'll follow. Mr. Everett, I will personally give the commissioner a call tomorrow about this matter.
Thank you so much. Thank you. That's one of the reasons that I wanted to be a part of this town hall, to let you know exactly what's going on. Thank you so much, Assemblyman.
All right, thank you for joining us, and I apologize for the delay on this. We're going to get back to you tomorrow.
Thank you.
Okay, moving forward, we're going to go to Rose.
Hi. So you may have heard the recent news about the expansion of pedestrian and cycling space on both the Brooklyn Bridge and the Queensboro Bridge recently. There has also been tons and tons of residents here on Staten Island and in South Brooklyn who would love to see some access to the Verrazano Bridge. But, you know, so far we have seen nothing because, of course, the Verrazano is owned by the MTA. As an assembly member, you have some power here, as the MTA is a state-owned bridge. I want to know if you plan on helping us to, get the attention of Governor Cuomo and the MTA and let him know that Staten Islanders deserve access to the Verrazano Bridge.
So Rose, thank you for joining us and thank you for that question. Many folks already know how supportive I am of when it comes to active recreation, and whether we expand bike lanes or pedestrian pathways. As far as the, I think you're adding bike lanes on the Verrazano Bridge. I think, look, if we can connect, I understand that there's this thing called, Rose, correct me if I'm wrong, it's called the harboring that kind of connects like like bike paths throughout the city. And I think the only part that's missing is Staten Island. Rose, is that correct? Can we unmute Rose really quickly?
Yes, that's correct.
All right. And so I do want to, definitely take a look at that with the MTA. If we can, I think we definitely got to get a cost estimate to see how much it would cost to get a bike lane added to the bridge that doesn't take away a lane. And if it does take away a lane on a bridge, what would that impact be to traffic? So we definitely got to get an analysis on that, but I could definitely get more information on that. But that is something that I am completely open to. And I think it's very important that we do have a pedestrian connection and a bike connection from Staten Island to Brooklyn. We already have it there's been a precedent set by the Bayonne Bridge and by the Goethals Bridge, right? And so I don't see why we can't look into this matter. And folks are paying a hefty amount on the Verrazano Bridge. So, I think, we got to see something with that. All right, Rose, so I'll definitely circle back. Did you have another question or did you want to follow up?
I just wanted to add that the MTA has been very insincere about what the cost would be. It can be done for much cheaper than they have let on. So I would love to talk further about that. We could definitely do so at a later time. But just be aware that the MTA has not been sincere about this at all. And that's why I really think that right now it's Governor Cuomo who needs to step up if the MTA isn't willing to sincerely engage with the public.
Understood. And I got a message saying that it would cost $20 million. Is that what you're hearing from the MTA about this?
The MTA is saying 400 million, which it can be done for 1/12 of the price. So yeah, they've been overinflating the cost just because it's not an interest of theirs. Because, cyclists and pedestrians don't pay fares. But that doesn't mean that we don't deserve access.
I hear you loud and clear, Rose. So we'll definitely we'll be on this one. All right. Thank you for bringing this to our attention as well.
Okay, next we'll have Mrs. Sparrow. Miss Sparrow, sorry.
Hi, thank you for hearing me out, but I see that today we have a lot of individuals from the community, especially locally here, and as president of Sparrow International, I was wondering if I could extend an invite to our community leaders, as well as our NYPD and congressional leaders, so that we can come together and talk about some solutions to implement that we can implement during this time. Because even though COVID has been a tragic time for all of us and it's been difficult, it also has presented an opportunity for us to reflect on the social issues that were brought to our attention. And with the shutdown, businesses struggling and families struggling, we can take this opportunity to implement change and start a dialogue. And I would like to extend that invitation. And it will be a closed door meeting, no media, and it will be in the near future. We could discuss a date where everyone's best available. Of course, due to COVID, it will be a Zoom meeting as well. So.
Well, thank you, Mr. Alfred, for sharing that. Definitely happy to connect you with the folks that you would like to invite there, and my chief of staff or deputy chief of staff can kind of make those those introduction meetings to the folks that you're looking to have involved in your group. So thank you.
Okay, moving along, Mr. Bufong, Isaiah.
Hello, can you hear me?
Yes, we
Yep.
can.
Hi. Hi, I'm Isaiah Bufong. I'm with the Young Leaders of Staten Island. So first, I want to thank you for having us. And secondly is our question. What are some things you are doing or plan to do to ensure the youth succeed in school and in life moving forward?
So one, we have to make sure that any proposed cuts to education is not accepted, and we push back heavily on that in the state budget. We also have to make sure that our nonprofits that are focused on working with our kids, I know NYPD is one of them, and so many others, making sure that they continue to receive the adequate funding that they have been receiving, and if not, it's the same level, it should be more. I also do think that, folks do, if you're not aware, we do accept interns in our office. So if you know of a young folk that is interested in learning more about government, let us know, send us the resumes. This is for me, something I've been doing since I've been in government. When I worked at the mayor's office, I always had a number of interns working with me. When I was a chief of staff for the parks department, had a number of interns there, same thing as an elected. And now that I have a whole team, is like very important that, I think they get an idea of that. So, that's, some of the stuff that I'm doing, some things I'm going to ensure that we have in the state budget, and also going to be paying very closely too to the city budget, that they don't eliminate some programs that would hurt some of the groups that have been doing, some work on the island.
Okay, moving along, Mr. Macbeth.
Hey, good evening, Charles. Really quickly, we've been trying to really get to assist the city and the state in getting folks vaccines, especially the elderly, those who are 65 and over, and especially in the attempt to try and equalize the disparity that already exists. My real question that lies in, I know that vaccines are coming. We always get the report they're coming, they're coming, they're coming. But we need some type of centralized place where we can temporarily deposit folks, because they can't get appointments until the vaccine is on site. And so it's really difficult. A lot of them aren't tech savvy. It's something we've been working on, but we're really hitting roadblocks. So anything you or your office could do to help with that would really be appreciated.
Thank you, John. One, that the vaccine rollout has been, it could have been done so much more smoother than we have seen it. And I think that, even the fact that, look, my office, we've done a robocall, we're getting information out to folks, and we're getting calls back, and we do have a list of folks that we've been helping out to get vaccinated. So if you know of anybody that's looking to get vaccinated, have an issue, whatever issue that may be, let us know, send us the name, their numbers, and we'll connect them, because we've been very, I think, successful with helping those that are looking to get vaccinated, and at least helping them get an appointment. So yeah, please let us know for any folks that you may know that may need a vaccine or that's having a challenge, so we could help guide them. This is definitely the biggest thing that everybody on my team is working on right now, because we want to make sure that we're doing our part to stop the spread and get our some level of normalcy, things back to normal.
Right. Thank you for that. And so just so you know, we've been doing exactly that with other offices that have offered the same assistance. But what we'll end up really doing is we're putting people in this flight pattern of standby. And I don't know what's actually unfolding on the other side. And we have to kind of keep going back to get the information. So like I said, anything smooth that over, that's perfect.
Yeah, no, and we're definitely happy to follow up with you with anybody that you send our way. And the sad thing is, the reason now you have a lot of offices that, like my office, that's like kind of, stepping up to the plate here to make sure that, we're aware of folks that are having challenges because of how terrible this rollout has been, and, I try not to, criticize it, but it is what it is. But at the same time, we have to acknowledge that this is the first time we're seeing a vaccine rollout of, well, not the first time we're seeing a vaccine rollout of this magnitude, because many years ago, there was, I think, a story in the New York Times that showed that like 5 million people got vaccinated in 2 weeks. I think the issue here is there's a lot of micromanaging happening from the executive level. And I think it's really impacting how things are distributed. And it's really, it's having an impact on where it's supposed to end up going. So I hear you loud and clear. And then, we're just trying to do our parts to make sure we're kind of bridging those gaps.
Who is the contact in the office?
Ruben,
Ruben?
Ruben, where are you? Ruben, can you on video me so everybody knows?
I have his number.
Ruben, his video is off. I think he's hiding from everybody, guys. So I don't know what's happening.
Thank you.
Thank you.
Okay, next question is from Jamita Haskell. I'm gonna unmute you.
Hi, can everyone hear me?
Yes.
Yep.
Hi, it's Jamita. Good evening, everybody. I had like 3 questions. One of them was for Dr. Stevens, but he came off. So hopefully you guys can follow up with him. But I just wanted to know, were there any studies or research being done on pregnant women with the vaccine or women that are currently breastfeeding? Because a lot of pregnant women are usually, because of the system, how it's set up, most agencies give you 2 weeks to 6 weeks to come back to work. And so even if you're an essential staff member, you're still putting yourself at risk. But if you're breastfeeding, I haven't seen any research towards that. So I just wanted to ask him that, if you guys could follow up with him or give us his information so I can shoot him an email. And then, so the second, this one is actually a statement just to keep you guys aware that most privatized hospitals are not communicating with families well enough about what's going on with them. A lot of the times, families are used as advocates to see what's going on, to make sure like staff is on their job. And I know that I've experienced it firsthand because majority of my family members are in the medical profession. And I know that they're burnt out, but there's not enough communication between medical staff and the families. So in December, for example, my nephew was in a horrible car accident. It wasn't due to COVID, and we understood that we couldn't go and see him. He was intubated for a while, but there just wasn't enough information that was being transferred to us as his family, and so we couldn't advocate. So in order to break that disparity, I just think that, especially with people of color, that's already there, right? We just need to bring that to light, because it seems like a lot of the privatized, hospitals are just kind of like winging it and doing what they want as far as like communication with the family. And then,
Jamita, is that you keep going if you have more.
No, go ahead. What were you gonna say?
Yeah, I was just gonna say, any hospitals in particular you're referring to that may be on the island or off the island?
So my nephew was at Staten Island University when that occurred, and then I had a friend of mine whose father was at Rumsey Hospital that felt as though there wasn't enough communication. And I mean, that's not on like nursing staff or CNAs, because again, they work very hard. But there needs to be like some type of advocate or communication officer, someone who is communicating what is going on with the family member, whether they have COVID or because we can't go in to visit.
So thank you for bringing this to our attention. I do know that Staten Island University Hospital is actually going to be hosting some community forum at the end of this month. I think it would be very helpful. I mean, we're definitely going to do our part and make sure that they're doing what they can to improve that communication. Obviously, if you have a loved one in the hospital, the least that they could do is communicate, especially if you can't be there with them during this period. So I'm going to have a conversation with the leadership there. But I also think, please be in touch with my office. We'll send you the information for that forum that the hospital is going to have. And what they're trying to do is better understand what they could do to improve the hospital's relationships in the North Shore. And when I say the hospitals, SIUH relationship on the North Shore. And I think this is one of those things that I'm definitely going to bring up during that forum. But prior to that forum, I'm going to have a conversation with their leadership. I think it would also be helpful to have your testimony there, since you've experienced this personally. And as far as the pregnant women and vaccines, I'm not a physician. I can't really give you the details on this one, but I do know that it wasn't, I believe there was some suggestions or recommendations that pregnant women should not take the vaccines. I'm not sure why, but I'm happy to get you the information once we talk to the doctor about this. And we can hopefully follow up with you, if not tomorrow, definitely by Monday with this information. The only thing I would ask, if you could, Satanji, do we have her email or a number that we could get back to her with?
She has it.
Yes, I have yep, I do.
And then I just have one last question. So, I asked you this last year at your last town hall, so I do appreciate the town halls. But Governor Cuomo was pushing for legalization of marijuana. And so I wanted to know, what were your plans as far as like creating an open the space for equitable entrepreneurship program when it does become legalized, and possibly like what your plan for involvement is in advocating for those to come out that were arrested for marijuana charges.
So when it comes to marijuana, I believe we passed a bill. Brian, we did something like, what, 2 years ago that kind of, Brian, do you remember what we did like about 2 years ago related to folks that may have received or arrest for marijuanas at the state level? That kind of, do you recall?
Yeah, no, yeah, I mean, we did pass legislation that would expunge certain records for individuals. I think maybe the question that she might be, bringing up is maybe your position on adult use marijuana. I know it's one of the part of the revenue resources that they're looking to implement.
Yep, yeah, I just want to know if we did expunge. So we did expunge.
Yes.
So yes. But no, my position on legalization, I've been supportive of it when I was a candidate, and when I'm in office, I still am. I still think that we need to have, one, there's already a black market out there, so we want to make sure that the state is doing all it can to generate revenue from this, but also I think we have to be very smart and safe here. The education to our children needs to be very clear on the impacts that it could have on them if they decide that they want to try that at a young age. But so the issue that we're having here at the state level is that the executive branch of government, the governor's office, think that the revenue for marijuana should go into the state's general fund. We in the legislature believe that the revenue for marijuana should go to communities that have been significantly impacted. So that's been a sticking point for the last 2 years, the two budgets I've been in office, and this year, I think because of the amount of revenue that we do need, we may be successful with what we've been trying to accomplish on this front. And it's look, at the end of the day, it's a negotiation, but this is like a sticking point for us in the assembly that we're not willing to kind of take away. But I understand, look, some folks have concerns on what that may mean for quality of life, but at the end of the day, we want to make sure that, we're doing what we can to do this in a safe and effective manner that doesn't really, significantly impact that, if that makes any sense.
Thank you.
Great. Thank you for your questions. We will follow up. Next is Mr. Richard Waz.
Greetings and thank you for this event. I truly appreciate it. I have more of a statement rather than a question, and that is this. I have been, for weeks and weeks, I had been trying to, as many people have, get an appointment for a vaccine. I'm eligible under the criteria. And what I wanted to point out to your office and you personally is that someone in your office really followed up in a wonderful way that was professional, that was kind, understanding, and courteous. And I would be remiss if I didn't mention the fact that Elena Hinckley was wonderful. She helped tremendously with me securing an appointment. So I just wanted to congratulate you for your good choice in staff. That's all.
Thank. Well, one, thank you so much. I do appreciate that. It really does mean a lot. I know my team, sometimes they work way too hard where I gotta tell them to go home or get off their computers. But I really do appreciate the kind words. And I know, look, as public servants, we work for you, so we try our best to do what we can to get you the answer. Sometimes folks may not be happy with the answer, but we try our best to look at every route before we say, look, this is the dead end we hit. This may be the other, so we always try our best. So that really means a lot coming from you, Richard. So thank you so much, and I do appreciate those kind words.
Thank you.
And I'm gonna find out who helped you so I could give those folks a credit.
Elena Hinckley.
Oh, okay, gotcha. Elena, good job.
Okay, thank you, Mr. Waz. Next is Stephanie Ward.
Hi, thank you so much. Thank you for holding this tonight. I think we are all aware that we are in a bit of a budget issue, especially because of COVID last year, but we were in a kind of a tricky situation even before that. I am curious as to how you're planning on pushing for some revenue raising for us. The proposals that Governor Cuomo had stated in his State of the State are just not going to be enough. There is a package of bills that there are a bunch of advocates that are pushing for called Invest in Our New York. And I just don't know if you're aware of them, and if you have any point of view on them. Some of the bills have already been introduced in the Senate and the Assembly. So I just wanted to get your opinion on that.
Absolutely. And when you say raising revenue for us, are you referring to a particular organization, a particular sector that you may work for?
New York State. For all of New York State, yeah.
Sorry, great. So there's a number of things, right? Obviously, we've been really pushing to get some federal aid, and I think with the administration we have in the White House and our U.S. Senator being very friendly, obviously being the majority leader, I think it's promising. But at the same time, I think we need to be mindful and consider other areas where we could raise revenue, right? And I'm gonna go over a few that I have on the top of my list that I'm supportive of. One of them includes raising income taxes on millionaires, those that are making 5 million, 10 million, and 100 million annually. The estimated tax revenue on something like this would be between 2.5 billion and 4.5 billion annually. There's another thing called the wealth tax, which would create a mark-to-market tax on New Yorkers with more than $1 billion in net assets. Something like this can bring in an estimated revenue of 5.5 billion. You have the stock transfer tax. This would basically tax stock trades, and we can generate $6 billion off of this. The last thing, and I spoke about marijuana, which could generate about 300 million. And the last thing I'll mention is the tier tax, which can generate 365 million. So if you add all those up, we're almost looking at between 15 and 20 billion dollars that we can raise through alternative areas that can help our state. And when we look at raising revenue, yes, we want to adjust our budget gap, but we also want to use these funds that we could have the potential of raising to help out our small businesses that have been hurting during this time. I strongly believe if government tells small businesses when they could open or when they could close, we should, as government, be able to, reimburse those businesses for at least the rent that they are owed, or that they owe, or you know what I'm saying. So other things that matter to the community. So increasing or helping out our workforce development. So these are things that I have taken a look at closely, and we've studied it, and we think this makes sense. It doesn't hurt the little people, the middle class. These are really things that really tax those that are super wealthy or millionaires.
Thank you so much. I would love to set up some time to come and spend more time talking to your office about this particular package. I think a lot of what you said that you've supported really lines up with a lot of these bills. So I would love to just be able to reach out to your office and chat a little bit more.
Sounds good. Thank you, Stephanie.
Thank you so much.
Okay. I believe we have 2 questions left. I'm gonna hold off on Isaiah. I'll come right back to you. I just want to get to Miss Linda Cohen because she hasn't had a question yet.
Hi there. I just wanted to echo Rose's statements from before. We're the only borough without a pedestrian and cyclist lane on a bridge to connect to the other boroughs. And it seems like on Staten Island, there are always a million excuses to say, no, we've been advocating. Well, not me particular, but I know people who've been advocating for this for like 50 years. And there's always people who are going to say, oh, no, we can't because of the suicides, or we can't because of the wind, or we can't because of the traffic. Last summer, in fact, we were asking the MTA, please just give us a lane during slow summer Sundays, for instance. And everything was a no. They're just so resistant. Just now, the Brooklyn Bridge is going to give away a lane on the very crowded Brooklyn Bridge. They're giving a lane to the cyclists. So I'm just hoping that we can just pass over the MTA and get the ears of Governor Cuomo, who oversees the MTA, and just ask him to make some sense out of this, because there are so many people who want, I have friends who call us Stagnant Island instead of Staten Island. And I'd really, really love for that to end. I'd like for people to make sense of this and give us what other boroughs are getting. So I'd really love your help and the help of other state legislators in getting the ear of Governor Cuomo.
All right, Linda, I hear you loud and clear. Thank you. Thank you for your comments.
Isaiah, I'm unmuting you again.
Thank you. I have 2 questions. One is, with the attention peaked on the opioid epidemic, what is your office doing to help end that issue? And the second question is, what are you doing to build trust between the people and government?
All right, so as far as the opioid issue, we actually opened up the first youth clubhouse in the district, which is a couple blocks away for people that have issues with this matter. So this is basically a space where if you are young folk, there are resources there that can help you out if you have any issues. I know because we have been in a pandemic, this issue has, it seems like it's been quiet, but it's really not so quiet. We just have to make sure again that we have enough beds on Staten Island for those that do need it. I know that's one of the things that I spoke to the executive at SIUH about the other day on kind of what their plans are in the next coming months to kind of improve their efforts here. But Isaiah, at the end of the day, it always comes down to more resources, and making sure that we have the providers that are here on the island that could be helpful to those that are in need. So that will continue to that will be something to be one of those things that we work on, and we're going to be also making sure that, again, as we go into the state budget, that there are no surprises that would impact Staten Islanders or anybody that's a New York resident that has this issue. And then the other question you had was trust. What are we doing to build trust with people in government?
Between people in government.
People in government. One, you start with these types of forums, having town halls, being accessible and transparent as possible. I already know people already have a perception of government. When you see speed cameras being put up in every single block, it makes you question government. You know, when you feel like there's a cop car waiting by a stop sign, then pulling you over because you may have, you know, you feel like that's a government overreach. You know, so I understand why people may feel a certain type of way on government, but, you know, as your representative, you know, my job to ensure that there is trust in government is to, you know, hold me accountable, right? You know, since I've been elected, I always have a town hall within 40 days of the year, right? That's like a fact. You know, my staff and team have been very, very accessible since, you know, day one. You know, we want people to, you know, if they feel like, you know, they're not getting their questions answered, you know, to keep pressing us until you get an answer. You know, I don't, you know really what else to say, but, you know, look, I as someone that has worked in government, you know, in the mayor's office, worked for a city agency, now being an elected official, I do strongly believe that, you know, government shouldn't be, you know, this machine that goes into your neighborhood that says, hey, this is what we think should be in your neighborhood, right? You know, government works for you. And I think for many years, it's been the other way around. And so, you know, when we have these public hearings, when we have these public meetings, you know, it's very important for me that the public sees and feels government working for them. You know, when you have issues like folks mentioned, they want to see a bike lane on a Verrazano bridge and they feel like the MTA is shutting them down. That's a problem for me, you know, and as a representative, I'm going to go have that fight with the MTA. We have to have a middle ground here. It just can't be no, no, no. Or the gentleman that has a problem with his sidewalk or doesn't have a sidewalk across the street, he has to walk on the street because people aren't getting back to him, right? You know, so government has to be held accountable by being responsive. And, you know, it also should be result oriented, in my opinion, you know? So I hope that answers your question. And I think I got,
thank you.
I'm sorry?
No, I just said thank you.
Yeah, no problem. And I think Brian, you want to talk about a bill that we have about opioid? Earlier?
Yes, yep, just unmuted. Yeah, so we actually introduced legislation. So throughout, even when we were in recess, the Assemblyman still introducing legislation. So with the end of the previous session, we had to reintroduce it because we're going to a new cycle. So if anybody on here wants to take a look at our bill, it's Assembly Bill 2567. And basically what it is that it actually provides that when an opioid is prescribed, the opioid antagonist shall be made available with that prescription in case of an accidental overdose. So as maybe some of you don't know, one of the more common antagonists would be Nexalon. So again, if a physician prescribes an opioid, he would also extend out a script for Nexalon. So one of the big issues here with opioid addiction, of course, is opioid overdose. So this legislation wasn't reintroduced, and we are continually working with central staff to move it along.
So, and thank you, Brian, for that. But just so everybody knows what Brian's talking about when he's talking about reintroducing. So after every term is up, because it's never guaranteed that a member will be reelected, every bill that we introduced previously, like within my first term, that didn't get passed and signed into law, we had to reintroduce it again, you know? So we haven't gotten to that point where we reintroduced it, but that's one of those bills we will introduce again because, you know, we've been just so busy with other things. So just want to make that very clear for folks that may not know. Thank you, Brian.
And just for clarification, we did reintroduce it. So the new bill number is 2567. So if anybody wants to take a look at it.
Okay. And then also SIPCW also shared that tackling youth substance abuse is also available. That's an organized, they do programming to help youth who are dealing with substance abuse, and we can share that link with anyone who's interested as well. So thank you, Sarah Blass, for sharing that information. And then, like I said, we had one question, but we have two more left. And I will call on Mr. Scalisi again, I believe, unless your hand was just left raised from before. You know.
Yes, thank you. Charles, Rose, Linda, regarding the Verrazano, it's a little complicated. As I mentioned, I happen to be a professional engineer, a traffic engineer, a licensed PE. And I was involved with the MTA on the movable barrier system, how to get that put in place. And I say it's not that easy, and it won't be that cheap, because it is a matter of laneage. Charles, I think you mentioned taking the lane out of service. A couple things in that regard. Linda mentioned something about doing it on a Sunday for one lane when other traffic is much lower. That could be. But there are standards to ensure that a bike lane is physically separated from traffic that's passing. Is there enough space, even within the one lane, to do that? I'm not going to make a comment on that. I am going to make a comment, though. It is a matter of volume versus capacity. How much traffic is going over the bridge versus how much capacity to move that traffic. And if you have too little capacity by taking away a lane, you could actually create a deleterious effect of having cars back up onto the expressway, generating congestion and air pollution for the handful of bikes or whatever number of bikes that want to use that lane. So that's one major technical issue. The other is, where does it go to and where does it come from? I know on Staten Island, on the Capitano Boulevard, there is a bike lane. So that seems to be an easy way to get on. But getting off, where is it going getting off? So there are a lot of issues here to consider. And it's not just no. It's some technical matters that need to be addressed. I heard a figure of 400 million. If you can't fit a bike lane on that bridge, maybe there's a chance to do what's called an outboard, a cantilever lane on the outside of the bridge. That's going to be expensive if you're going to do that. And I'm not even sure technically can that be done or physically can that be done. So it's a little complicated. Yes, mention was made of the mayor's comment about the Brooklyn Bridge. I can tell you right now, I know the Brooklyn Bridge well from a professional point of view. That is, you take a lane away from that is going to create a major traffic backup into Brooklyn. So that's a willy-nilly comment, I believe he said, without having all of his technical issues on hand. So again, there are a lot of issues to consider. Charles, I just wanted to give you some technical background. When you do go to MTA, responsibly, they will have their traffic staff address these kinds of issues. So not that easy, just to sort of throw it out there. Thank you.
Thank you, Stephen. I recognize being in government, nothing is ever easy. But I think too, one of the things that the public always looks for is, when they ask for something, especially if it's in huge numbers, they kind of want to see their government respond with at least some options, what's feasible, what's not feasible. But the problem here, right, is the MTA has a reputation of not being so transparent with some things, right? They'll do things in other boroughs, but then they'll leave Staten Island out of the loop, right? And it goes back to that whole notion why Staten Island is a forgotten borough, right? Because you look at the toll situation. Why is Staten Island the only borough in the city of New York that only has one bridge that's really high in tolls, right? Whereas the other boroughs have one bridge that's at least free when you go in or out. That's just one example, right? And I think it just goes back to that perception issue of what Isaiah was talking about. How can we build trust in government, right? So the MTA, and I hear your point about I'm sorry. Yeah, and I hear your point, but I think also, it's very important though that the agencies remember that they work for the public, even though they, may have applied for their job through an online panel. They're public servants, they're public employees, they're being paid with taxpayer dollars. And I think government has gotten so big where, they seem like they could get away with anything. And we just have to remember that, look, they work for the public, and the public deserve, fair answers or options when it comes to these matters. I didn't know if you want to respond, but that's just my 2 cents when it comes to that.
Okay, thank you. And so our last question of the evening is from Ms. Gazzo, I believe your last name is.
Hi, Lillian.
Lillian.
Assembly Member, hi, Lillian Legazzo. and I am a 42-year city worker, happily retired 10 years. So I'm a senior. But I'm now living on Bay Street Landing, and I ask if you and your office staff could monitor some of the major city waterfront projects that are planned. The promenade in Tompkinsville, which runs from the Lighthouse Museum to Miller's Launch, that was destroyed in Hurricane Sandy prior to my living here. But there's FEMA monies, 35 million that's set aside for that. EDC is working on the design. So that'll be part of the contiguous waterfront that's being planned all the way up to Stapleton. To get to the Stapleton Site A on the waterfront, they're building new homes, new multi-story buildings, affordable housing, and I would hope that it's for working families of different income levels. So we will have a variety of constituents in the area. But my concern is, in knowing the city, we don't have sidewalks there. It's what about water resiliency? What about infrastructure? What about sewers? If you put a building there, how are people going to access the nearest train station? Clifton in one direction, Tompkinsville in another. That's quite a distance. If you have an older person or somebody pushing a carriage or carrying a, walking with a toddler. So those are considerations. There's no bus route there. Where are the young people going to go to school? Again, we're going to tax some of the hospital facilities nearby. So these are all considerations. I know you're at the state level, but this is going to be a whole new community. It's like, if you build it, they will come. Yes, but we need to make sure that the city does its part to make sure that that infrastructure is there, because that's going to impact the new community plus everybody in the outlying areas. And again, they want contiguous walkways, but there's a lot of work that needs to be done with that. And I would hope that you just keep your eye on that project to help all of the constituents, the current and the new people coming in.
Thank you, Lily. One, I'm very familiar with this project. This EDC project that you're talking about along the promenade, if this project does not happen, it does not allow the HPD products to move forward. And I'm very familiar with this. I've actually been in conversations with the mayor's office. I know they did give me an update that they're still trying to work some things out with the Office of Budget related to this matter. And look, this is, anytime we can give access to the waterfront to residents that live in the neighborhood, it's a plus. We have to, our waterfront has been underutilized for so many years. And this would be one of those projects that I want to see come together. It's very important to me. The mayor understands how important it is to me. And I'm very familiar with it. So definitely it is on my radar and my team's radar, and we'll definitely keep you posted on what we hear on it. But I know it's in OMB's court, the Office of Budget. Just a quick question. And I guess, is Javon on here? Lillian, have you heard any concerns related to any quality of life issues in the area? Has it improved related to Tompkinsville Park? Just kind of curious to, your perspective on that.
I don't usually walk out there. The only time is if I have to access to the train. I think it's gotten quieter. The openness of the park when they demolished the comfort station down on Bay Street. It's certainly an improvement. The drug dealing may have dissipated. I don't know what the police records are, but it's, I don't really get onto that side of the area unless I'm going up to the supermarket. So I really don't have data.
Gotcha. And I'm curious, is Satan Javon on? I can't, I'm looking for, because I have a question for him.
The lighting was always an issue there. And with the, with the HRA social services office there, it's closed from Friday to Monday and there's nothing going on. But again, I'm not there, so I don't see it myself.
Gotcha.
We got the wine pool, we have the Cromwell Center is coming. Those are all positives.
Understood. I don't know my director of community. Huh? All right. Anyway.
Yep, he's unmuted. He just unmuted.
Right. Hey, Javon, can we follow up with, oh, no, my pleasure. We just want to make things, we want to improve things the best that we can, you know. But Javon, if you just, so Javon Parnell, right there is our director of community affairs, and he's very familiar with you know, some of the issues we've gotten in the area. So yeah, Javon's gonna definitely follow up on some of those things with the Parks Department, and you know, just to, you know, make sure that you know,
There's a concern about the, you know, 44 Victory happening, security afterwards, children crossing the street, how are they going to get to school? St. Paul's and Victory is a very heavily trafficked area with cars. A lot of issues that need to be worked out towards implementation there and opening.
Gotcha. All right, thank you, Lillian.
Thank you, sir.
All right. Is there any other questions, comments? Oh, Mr. Justin, what I see? I think that was a clap.
No,
Justin.
I know. I'm so sorry. I couldn't figure out how to do the raise hand. And thank you so much, Assembly Member, for taking one more question. I'm a new constituent of yours in the district, and also I work with New York Lawyers for the Public Interest and New York Renews, and wanted to end with a thank you for supporting and voting for the Climate Leadership and Community Protection Act in 2019, which was so important for communities like Staten Island that have seen the worst impacts of climate change with hurricanes, with flooding, and with the air quality we have here from all the power plants and other pollution sources. And we're just hoping we can work with you, and within a couple weeks, we should have a bill introduced going back to the revenue side of things, which is so urgent, and the jobs side of things. There should be a bill introduced called the Climate Leadership Investment Act that would actually give the state a huge amount, like $10 to $15 billion in revenue to create green infrastructure and green jobs by taxing the biggest polluters. And we have a lot of them nearby polluting our air and water here in Staten Island. And so we're hoping we can work with you on passing that bill and count on your support. And I would just say, you know, we're seeing things like 200 million for offshore wind manufacturing in Brooklyn, and that's awesome. And they need those green jobs too. But that's the type of project that would be just so great to bring here to the North Shore and build some green infrastructure and some renewable energy, among other things, along with the Verrazano bike lane. So hope we can count on you, and would love to talk to you and your staff about that.
Look, once you go green, it won't be mean. I mean, I know this sounds corny, but I think it's the right way to go, you know. But I you know, echo what you said. You know, we have to, you know, think about our future here. Climate change is, you know, it's not a hoax. It's you know, science kind of speaks to it already. And this is something that we have to take very seriously and start making the investments now. And one of the reasons I'm so sorry for anybody that has been inconvenienced by this. But one of the reasons why we banned plastic bags, I know many of you had to go to the supermarket, like, oh my gosh, I forgot my, you know, to-go bag, and there's no plastic bags there. But part of the reasons we want to change behavior, and I want to apologize in advance if you're one of those folks that aren't happy with that. We do have, Ruben, we still have bags, right? Recyclable bags that we can still give out to folks?
Yes, we still do.
If you need reusable bags, in an effort to say I'm sorry for banning plastic bags.
Thank you so much.
Thank you, Justin. And I'm looking forward to seeing more of that legislation. So if you could maybe at some point connect with my legislative director, Brian Early, that would be great.
Yes, I'll send you an email first thing tomorrow, Brian. Thank you.
Thank you.
Okay.
I think we have two more questions. I see Lillian has her hand up, and I see Linda Cohen has her hand up as well.
Assemblyman, just one thing, because of at Lighthouse Museum, now we have snow and all, but the homeless are there. There are people shooting drugs. I forget, right in front of Lighthouse Museum. That's always a problem with garbage. You know, the city tries to pick it up, but people do hang out there, and you don't want to be walking through the old Coast Guard area at night, but people do congregate and play
Well, one of the
music.
things we'll reach out. I know in the past, you know, folks have been very quick to call NYPD when it comes to homeless related matters. But one of the things we've done differently here is we reach out to homeless providers, let them know about the resources that they have. Sometimes, you know, those folks don't accept it, but we always try to find a balance here where we could get them help and try to address some of the issues in the area, so we're not, you know, criminalizing them, but getting them the help that they need. So Javon, if you could just follow up with, you know, the providers that we have, that we've been working with on this matter, so they can kind of, you know, look at that site. Lillian, is there like a specific time and date, or a specific time and day during the week where you notice this behavior, where we can?
Early evening, it's people hanging out on the rocks and having sex. I'll be perfectly honest. There's people that are, whose apartments are closer to the plaza area hear more of the noise. You know, the fishing pier is closed, so that may have, you know, stopped that activity.
Gotcha.
We'll have to see as it gets warmer, Assembly Member, what transpires.
All right, but yeah, we definitely want to
When the
address
weather
those
changes.
as possible. So yeah, Javon, if you could please, tomorrow just touch base with our folks so we can kind of, you know, get on that.
Charles, I was actually going to tell you that we was over there in the summer having out the PPE and everything, and there was officers riding around and clearing out the park over there near the area, like near Tappan Park and everything down there. So the officers are aware of that.
No, this is.
Gotcha. I think, you know, no, this is near the Lighthouse Point, not the park. And the day that was happening, there was an issue in the park where it became very dangerous. So that's why they had the officers clear it out. So nobody has a perception that the officers had to clear it out because of something. But I remember that day. But yeah, she's referring to Lighthouse Museum, and I think there's another section by the ferry where I know where you're referring to. A different area as well. But thank you. Yes. I see we have one more question, or is that yeah.
That for me?
Yes.
Yes.
Okay, thank you. One issue that I was a bit concerned with was the new dredging that's being proposed for the by the ACOE and the Port Authority to deepen the Kilvan Cull another 5 feet. There was the recent dredging project that got it to 50 feet, but now they want to go back into the Kilvan Cull and deepen it with a project that will last more than 10 years with, you know, more drilling and blasting. They needed to go down to 55 feet. And there were concerns raised by our environmental organizations here in Staten Island, including the environmental justice community. There's concern because something called a FONSI was issued, which stands for Finding of No Significant Impact. And people do think that there might be more toxins released into the Kilvan Cull in a time when we're still trying to clean up old toxins in the Kilvan Cull, including the terrible toxins like at the Archer Daniels site. So I guess I was just wondering if you have a comment. Another concern was that last time around with the dredging, apparently there were a lot of skilled jobs that were promised that didn't come through. So that was just another thing. So I was just wondering, because I didn't hear from any of our electeds about this, and I was wondering if you would have any comments about it.
One, I am familiar with the past dredging along the Kilvan Cull from years ago. I am not familiar with this new proposal that you just brought to my attention, which is very concerning because I should have an idea of what's going on the waterfront side of my district. But we will reach out, Brian Satanji, if we could just check with the Port Authority and get more information on this, and let them know why we have to find out during a town hall that this is happening. I think that's kind of, thank you, Linda, for bringing this to my attention, but we're gonna follow up with that.
I know that Community Board 1 was given some kind of talk about it a few months back. We asked for their their comments back, but we didn't hear. So some people in the community know about it.
Gotcha. All right, but we'll find out about that. All right.
Thank you.
All right, so I see that that's our last question. I see that we have Eloise Hirsch on here from Fresh Kills Park. Eloise, I didn't know if you want to do like a quick selling point for Fresh Kills Park and why it's great during the days of, I know there's like days during the year when they open the whole park to the public. You can ride a bike through the whole park and do so many great things there. But maybe Eloise may be away, but yeah, definitely Fresh Kills Park does have some, it's a very, it used to be a landfill, now it's capped, it's used as a park. There's a lot of great things there, and she's the administrator there, but I don't think she's near her computer. And then, yeah, I just want to thank everybody again for, joining us. I want to thank again the Staten Island Chamber of Commerce for helping us get the word out with this event, the Lower East Side People's Federal Credit Union, Literacy Inc. Satanji, I'm forgetting 2 people. Can you please help me out so we don't forget nobody that I did not mention?
Just the DOHMH, again, anybody who had their questions related to COVID and health, we will circle back with them. And I believe, and then Staten Island Partners for Community Wellness as well. They provided a lot of great information that we'll circle around with everybody as well.
Great. Thank you, Satanji. And look, anybody, if you know anybody that's I think everybody that's on this call right now, you guys all play a part too in sharing information to the community. I would say information is a power wealth. Let them know that we're here to help with whatever we can. And about the resources that we shared, every week we send a weekly report. If you're not on my email list, I encourage you to get on that so you could have an idea of kind of what's going on in the district in terms of resources, events, what we're doing in Albany, the bills and laws that we're passing or we're considering, and how that may impact your life. I also have a new counsel on board, Lucas Guerrero, who's on right now. Lucas, I don't know if Lucas is near his computer now, but any like type of legal questions you ever are looking to there, I think there he is. Yes, yeah. He's right there. Any legal questions we have, Lucas is always happy to fill those for you, and we're looking at maybe probably setting some time up where we could do some things in the office with the public. So with that being said, thank you guys all for joining us. Obviously there's always going to be more events coming up. Don't forget, we're going to have the event on ranked choice voting on the 24th of February. And the reason why this event is important is because, the way you vote this primary for your city council member and your borough president, it's not going to be the same. Instead of no longer voting for one candidate, you're voting for a number of candidates. So you can vote like, this is my number 1 candidate, this is my 2nd choice, my 3rd choice, 4th choice, 5th choice, right? So it's going to be very weird, awkward. I don't even know why that's in place, and I'm still understanding it. But we're going to have a panel that's going to include the public advocate, someone from the campaign finance board, and a couple groups that were advocating for the ranked choice voting, so that folks in the public are familiar with it. And if you have, you can also share with folks in the public. So special thank you to my chief of staff, Tanya, for all of her efforts, and Javon Parnell for all that he does, and who's our director of community affairs, and Ruben Seaver, our deputy chief of staff, and Brian Early, who's our legislative director, and of course Lucas, who's our counsel, for all their efforts and for being available around the clock. We have office hours that are now available, so let us know when you want to meet. Give us a call, send us an email. I don't want to take up too much time, but I know it's dinner time. I'm hungry, and it's time for me to, finally get a nap maybe tonight. Guys, thank you so much. God bless. Be well. Be safe.